Kubler-Ross identified that patients and families demonstrate various characteristic responses to grief and loss. These stages include denial, anger, bargaining, depression, and acceptance, commonly referred to by the mnemonic DEA-BDA. The illustration of the Kubler-Ross grief cycle can be found on the next slide. Keep in mind that these stages of grief not only occur due to loss of life, but also due to significant life changes such as divorce, loss of friendships, loss of a job, or diagnosis with a chronic or terminal illness. Kubler-Ross grief cycle. Denial occurs when the individual refuses to acknowledge the loss or pretends it isn't happening. This stage is characterized by an individual stating, "This can't be happening." The feeling of denial is self-protective as an individual attempts to numb overwhelming emotions as they process the information. The denial process can help to offset the immediate shock of a loss. Denial is commonly experienced during traumatic or sudden loss, or if unexpected life-changing information or events occur. For example, a patient who presents to the physician for a severe headache and receives a diagnosis of terminal brain cancer may experience feelings of denial and disregard the diagnosis altogether. Anger in the grief process often masks pain and sadness. The subject of anger can be quite variable. Anger can be directed to the individual who was lost, internalized to self, or projected toward others. Additionally, an individual may lash out at those uninvolved with the situation or have bursts of anger that seemingly have no apparent cause. As a nursing assistant, you may possibly be the target of someone's projected anger. Healthcare professionals should be aware that anger may often be directed at them as they provide information or provide care. It is important that healthcare team members, family members, and others who become the target of anger seek to recognize that the anger and emotion are not a personal attack, but rather a manifestation of the challenging emotions that are a part of the grief process. It often comes from a loss of control in the situation and a feeling of helplessness or hopelessness. If possible, the nursing assistant can provide supportive presence and allow the patient or family member time to vent their anger and frustration, while still maintaining boundaries for respectful discussion, rather than focusing on what to say or not to say. Allowing a safe place for a patient or family member to verbalize their frustration, sorrow, and anger can offer great support. Bargaining can occur during the grief process in an attempt to regain control of the loss. When individuals enter this phase, they are looking to find ways to change or negotiate the outcome by making a deal. Some may try to make a deal with God or their higher power to take away their pain, or to change their reality by making promises to do better, or give more of themselves if only the circumstances were different. For example, a patient might say, "I promised God I would stop smoking if He would heal my wife's lung cancer, or I'll go to church every week if I can be healthy again." There may also be thoughts such as, "Why isn't this happening to me instead of my child?" Feelings of depression can occur with intense sadness over the loss of a loved one or the situation. Depression can cause loss of interest in activities, people, or relationships that previously brought one satisfaction. There is no pleasure or joy surrounding anything. Additionally, individuals experiencing depression may experience irritability, sleeplessness, and loss of focus. It is not uncommon for individuals in the depression phase to experience significant fatigue and loss of energy. Simple tasks such as getting out of bed, taking a shower, or preparing a meal can feel so overwhelming that individuals simply withdraw from activity. In the depression phase, it can be difficult for individuals to find meaning, and they may struggle with identifying their own sense of personal worth or contribution. Depression can be associated with ineffective coping behaviors, and nursing assistants should watch for signs of self-medicating through the use of alcohol or drugs to mask or numb depressive feelings. Any remarks made about feeling depressed or talk of self-harm should be reported immediately. Other symptoms to report include noticed changes in behavior, such as isolation or withdrawal from activity, sleeping more or less, and decreased interest in hygiene and self-care. Further discussion about depression can be found later in the course. Acceptance refers to an individual understanding the loss and knowing it will be hard but acknowledging the new reality. The acceptance phase does not mean absence of sadness, but is the acknowledgement of one's capabilities in coping with the grief experience. In the acceptance phase, individuals begin to re-engage with others, find comfort in new routines, and even experience happiness with life activities again. This may be observed by a person saying, "I want to make the most of the time I have left by spending it with my family," or "I'd like to plan the arrangements for my funeral," or "I know this will be painful and difficult, but I will be okay with the supports I have." As already discussed, the grieving process is different for each individual and is not easily predicted. The best action for the caregiver is to listen closely and offer support to the individual. Other possible interventions for the NA to assist with the grieving process are described in the table found on the next slide. Table of suggested actions by NA. If the dying client lives in a facility, it is important to consider how their death may affect other residents, as well as the staff members. Some facilities may offer grief counseling that includes sharing thoughts, feelings, or memories of the deceased in a group or individual setting. A memorial service may be held at the facility for residents and staff, separate from the family's plans. Staff and residents will also work through the grieving process, so offering the same interventions as listed above is warranted. Additionally, it is good to promote self-care by maintaining adequate nutritional intake and sleep.